Hi, today we are going to discuss the topic that is rabies. That is rabies. So, in rabies, uh, under that we'll learn definitions, causes, risk factor, sign and symptoms, and diagnostic evaluations, medical managements, and nursing managements. So, first of all, we have to know what is rabies. So rabies, that is a viral disease caused by the rabies virus, and which affect the uh, the nervous systems of mammals. Main causes of rabies primarily causes the rabies, that is like animal by the bite of the animals, animal scratches. Okay, so like infected animals, usually dogs, cat, bat, raccoons, okay, transmitted the viruses through the bites. Okay. Now we'll see the definitions of the rabies. That is, rabies is a viral disease. Already I told you that rabies, that is a viral disease uh, caused by the rabies virus, typically transmitted through the uh, bite of uninfected animals, and it lead to a severe neurological symptoms, and it almost always fatal once symptoms appear. So rabies, that is a viral disease, which is viral disease caused by rabies virus, and it will affect our nervous systems of mammals, and it lead to severe neurological symptoms, and is almost always fatal once symptoms will appear. Once symptom will appear. Next we'll see the causes. So here main causes is, we know that is a rabies virus. Okay. um, so causes here, we can see here transmissions. So primarily spread through the saliva of infected animals. Okay, so primarily it will transmit through the infected animals by the bite of the animals or scratch. Common carriers include here like dogs, bat, raccoons, foxes, skunk. Okay, so these are the causes of a rabies. Next we'll move on, that is a risk factor. So what are the risk factor here? So risk factor we can see here that are like geographical locations, occupational exposure, recreational activities, unvaccinated pets. Okay, so these are the risk factors of a rabies. Next we'll move on, that is a sign and symptoms of a rabies. So sign and symptoms of a rabies, that are like initial symptoms will appear like fever, headaches. The persons will feel headache, and general weakness or discomfort will be there, in that is in a initial stage. Later on, in progressive symptoms, anxiety will be there, confusions and hallucination means that is a false beliefs. Okay, and hydrophobia. Okay, hydrophobia means that that is a fear of water due to difficulty swallowings. Okay, due to difficulty swallowings. And next is paralysis, coma. Next we'll see that is a lead symptom. Okay, so lead symptoms here uh, will be the severe neurological symptoms leading to death. Okay, in lead symptoms, it will appear like severe neurological symptoms, which will lead to a death also, usually within weeks to months after onset. Okay, so these are the sign and symptoms of a rabies. Next we'll see diagnostic test. So what are the diagnostic tests we can do for this rabies? First of all, clinical diagnosis is required based on history and based on history of animal exposure and symptoms. Next test we require that is a laboratory test. So in laboratory test we have to do that is a DFA. So DFA means that is a direct fluorescence antibody. So this test on brain tissue. And next is serological test for antibodies. So these are the tests we required in rabies. Next we'll move on in medical management. So in medical management, basically here uh, we require that are post exposure prophylaxis, PEP. Okay, immediate treatments is required through wash the wound with soap and water for at least 15 minutes. Okay, after biting the uh, animals, we have to wash the uh, infected area or that's wound area with a soap and water at least 15 minutes we have to do. Next is required that is a rabies vaccines. Okay, we have to administer in a series of shoot 4 doses over 14 days. Next required that is a rabies immunoglobulin RIG. So this is given in conjunctions with the first vaccine dose for high risk exposure. So these are the medications of a rabies. So next we'll move in a nursing management. So in nursing management here wound care is required, supportive care, psychological support. Okay, so these are the nursing management. Next complications is here, like one clinical symptom will appear. Rabies is almost universal fatal. Potential complications from PEP include like allergic reactions to the vaccines, local reactions at the injection site, pain will be there, swallowing. So these are the complications of a rabies.